Hello, my name is Dr. Mark Poray, and I'm a family and sports chiropractor in Brooklyn, Ontario. I've been in practice for over 29 years, and the topic for today's blog is children's headaches. Now, headaches in general, are extremely common. We all know that. There are migraine headaches, there are cervicogenic headaches, and tension headaches. For more information on all these types of headaches, you can access the video blog in my website archives. It's typical for patients to be treated for many headaches in my practice. Generally, cervicogenic headaches and tension headaches respond extremely well to chiropractic care. And many migraines are also treated successfully depending on their particular triggers. Most parents, however, live with the mistaken idea that children don't get headaches. The joke in my office is generally that children don't get headaches, they cause headaches. In fact, your chiropractor or your family doctor will tell you that headaches in children are extremely common. Most children who have recurrent headaches suffer from migraines. The prevalence, in fact, indicates that 10.6% of kids between the ages of 5 and 15 and 28% of adolescents between 15 and 19 experience some sort of migraine headache. The result of these is that many children have increased absences from school and decreased school performance and decreased socialization with their family and friends. Obviously, if you've got a headache, especially a migraine headache, which is quite severe, you don't want to be around other people. Now, the pediatric patient with migraines generally presents with one-sided throbbing headaches, just like an adult. If they're recurrent, they will usually occur on the same side, whether it's the right or the left, and there may be a familial predisposition. In other words, if migraine headaches occurred in the mother or the father or the grandparents, there's a likelihood that the child will also have those migraine headaches. Some of the other symptoms may include nausea, vomiting, light or sound sensitivity, and they may be preceded by some sort of visual auras or scotomas. They're either zigzag lines or lightning bolts or dots or one-sided darkness, whatever. If the headaches are one-sided but they occur from one side one time and the other side another time, they're more than likely cervicogenic headaches, or headaches that originate in the neck. Regular tension headaches are band-like, and they occur mostly in the back of the head or the sides of the head, but are generally on both sides. Now, don't forget ocular headaches, which can result from eye strain, or sinus headaches, which will usually be found above the eyes and accompanying some sort of a sinus infection. Now, the treatment for headaches in children is similar to that for adults. It involves moving, stretching, and manipulating the spine. The difference lies in the amount of movement and the intensity of the manipulation. Children's spines are obviously smaller with less muscle mass. That means they require less to achieve the same results. Sometimes, depending on the symptoms and the presentation, the chiropractor may suggest x-rays to determine the severity or the origin of the problem. If he feels the problem lies outside his scope of practice, like an infection or eye strain, he may suggest a visit to the appropriate specialist. Now, once I have determined the cause of your child's headache and that it is something I can help with, I'll suggest a treatment plan which, depending on the length of time that the headache has been there, will usually take between 4 to 6 treatments spread out over 4 to 6 weeks. I'll generally start with some soft tissue treatment of muscular trigger points and use gentle manual traction to help release the elements locking the upper cervical vertebrae. Finding and treating these triggers, these tender trigger points, helps to confirm that this is in fact a cervicogenic or tension headache. This is then combined with gentle mobilization techniques of the neck joints. In some cases, I'll utilize one of 2 special adjusting tools, which are very specific and very safe. These are called the activator which is this tool right here, and it delivers a very small little blow, a click, and that avoids cracking the neck. And the other tool is the neuromuscular impulse instrument, which is similar, except it delivers six exactly the same impulses to the area. It's very gentle, very safe. Now, if you want to find out a little bit more, you can click the tab for the neuromechanical impulse instrument on this website that you're watching right now. Now, most children are pain-free after this treatment plan, but periodic checkups may be suggested, especially if the child is involved in an activity, a repetitive activity, that may have caused these headaches. So here are some of the other things that you may want to watch out for in a child who experiences headaches. First of all, take a look at their posture. Second, limit screen time, both television and computer. Get regular exercise and watch artificial additives in their food. And of course, you need to be vigilant after falls in certain sports. As important as the treatment is for the headaches is to prevent recurrences. You need to watch out for poor posture when your children are working on the computer, as this appears to be a major cause of kids' headaches. Slumped positions with chins poking forward will compress joints in the neck and eventually may cause muscle tightness. And repeating this activity day after day can result in permanent tissue changes later in life. Some of the other things to watch out for, some of the other causes of maybe poor posture, including things like doing homework on a bed, watching television, and some intense sports activities. So investigations of the causes of headaches should also include school desks and classroom lighting. Carrying heavy bags is another cause. Children in primary school, from kindergarten to grade 7, should probably be limited to carrying less than 10% of their body weight in their backpack, while high school kids should not carry more than 15% of their body weight in their backpack. Regular exercise for kids that is very helpful may include things like yoga for children. This will encourage both muscle strength and flexibility improvements. Finally, avoid food additives like aspartame, which are present in a lot of pre-sweetened foods and drinks. And while there's no evidence, no direct evidence, to link headaches with being thirsty, it is a good idea to make certain that your kids will remain well hydrated, especially in the hot weather and during sports activities. You can get more information about backpacks and how to select them for your kids by viewing that particular blog again in the archives on this website, www.drporay.com. Thanks very much for listening again. I'm Dr. Mark Poray, a family chiropractor in Brooklyn, Ontario.